Hi, everybody. Welcome back to Teens Uncharted. I'm your host, Charity Chaffee, adolescent and teen therapist. I'm excited to introduce you to our next guest, Dr. Angela Parente, a distinguished clinical psychologist based in Boston, Massachusetts. She has over 2 decades of experience in clinical and organizational psychology. She specializes in providing structured, solution-focused treatments utilizing approaches such as DBT and CBT. So in this episode, we are going to talk about our insights on navigating the complexities of special education, delving into the multifaceted journey of parenting, and discussing her approach to training and supervising clinicians to prepare them for the impactful work in the field. Very excited to introduce to you our guest, Dr. Angela Parente.
Parente, yes.
Parente. Okay, I was close. All right, awesome. So it's funny because I feel like I kind of stalked you on Facebook because I was like, I want to chat with you, and really understand kind of like the academic piece because you're more of a, would you call yourself more of a specialized education support person?
I don't think so. I think I would lead with a curious person, and I'll start with my love of teenagers and the work that I do started in my own high school career. So I feel very privileged to at 17 sort of taken a class and knew like, wow, that's so cool. The brain is cool. Human behavior is neat, and followed that trajectory into graduate school and getting my degree in clinical psychology. But I've kept that lifelong learning and interest in teenagers and adolescent and young adult in my career, which has spanned a few decades. So I feel very privileged to at 17 sort of taken a class and knew like, wow, that.
Okay. So where are you now? What is your work like now? You want to give us a little intro?
Sure. So my work currently is in a group practice. So I'm getting to make decisions on my own about the care that I want to provide, and looking to build some coaching and consultation to really use the experience and expertise that I've gained in working in community mental health and community health centers where I learned and practiced in school-based health centers from elementary, middle, and high schools. So I was actually placed with medical teams in schools. So I was not part of school districts, but part of the healthcare that was offered on site in schools. And that led me to working in a school district and developing and running a program for students with social emotional disabilities and seeing the spectrum of what could be done and how we could support mainly adolescents. That's who I worked with in school to really keep them in their hub and their school community. And expertise that I've gained in working in community mental health and community health centers where I learned and practiced in school-based health centers.
Okay, I love that. So in their school community, in their spaces, not having to kind of like go out of district into like long drives, etc.
Yes, my goal in the work, and I did that for about 15 years, was to really develop what could be done in schools and to differentiate students that could stay within their own sort of home base and with their own peers that they had gone typically elementary, middle school, and followed along, played sports with, did after school programming with. So keeping them in their home base with their peers, but knowing that there were certain times when a chronic mental illness or other things would necessitate the need for students to be removed and placed in a more supportive educational and therapeutic setting. Yes, my goal in the work, and I did that for about 15 years, was to really develop what could be done in schools and to differentiate students that could.
Yes. Okay. Okay. So that's kind of like I guess the last step we would take, right, to try to educate someone. Because in my experience is that a lot of schools, they want to keep kids local. They want to kind of keep them there. Can you talk about the process of like 504 IEP and kind of how you've seen that evolve to, let's say, like a day program or like a therapeutic schooling environment?
Sure. When you look at sort of the educational experience that we have in the US and in Massachusetts specifically, there are certain moments in time where we see kind of these little spikes of stress that happen. And typically it's during the transition years that we see students may have additional struggles that present themselves. So anytime a child is moving from elementary school to a middle school, the middle school transition to either junior high, if it's not a middle school, or high school, any of those transition years. It also happens during specific educational transitional moments. So fourth grade is a tough one. It's when our teaching changes. It's no surprise that MCAS had started sort of in those years. Also in high school, typically the junior year becomes really difficult. Freshman year is an introduction to high school, and so people get acclimated, and there's lots of support that often happens. Sophomore year, you're kind of ramping up. By junior year, students tend to present with struggles because things become harder for them. There are any learning issues that they've been able to manage earlier on in their education, sort of the challenge becomes too great and it becomes harder for them to manage that. And often that can lead to kind of a presentation of anxiety or depression or something else. So that's just developmentally when things can present. And for parents, it's good to connect with school personnel during those transitional years if you see your child having a difficulty and it's not kind of resolving itself. If that happens, a 504 is one of the first stops. Talking to your adjustment counselor or guidance counselor, establishing a relationship there where you can see, are there, number one, supports that can happen without a 504 or without any intervention. Most schools offer that, and if you ask, they will offer extra time or different sort of accommodations that happen and are accessible to all students, regardless of any sort of paperwork. But if you feel like your child just got diagnosed with ADHD, or you're noticing that they're really struggling and there's something specific, you can advocate to have a 504 plan completed and put into place and implemented at their school. And that can happen again, elementary, middle, or high school. And that provides certain accommodations to your student, your child, that can help them in the learning environment.
And that's more of a social emotional piece as well, right? Because like
It can be. It can also be 504s are used for various disabilities. So it can be for other things, but we're talking social emotionally now. So those accommodations could be, again, the extra time or the ability to leave a classroom, to take a break. Those sorts of things can be built into that.
okay, okay. So if that doesn't work and the kid needs more support, then what do we do?
So if you're finding that there is that they're not performing to the level that you would expect, and I think this is a touchy point because sometimes we look at grades as kind of the metric, and we say, oh, like Johnny isn't getting an A, there must be something wrong. I need to have him tested so that we can figure this out. Johnny may not be an A student. That may not be the metric to look. So you have to know your child and know and have a reasonable expectation of what their performance would look like. If they haven't done well in math throughout their kind of educational career, to expect that they're going to nail it in kind of their algebra class isn't probably realistic. So knowing that their performance level at that expectation isn't being met can give you a clue. So you have someone that has done really good in classes and all of a sudden isn't able to kind of perform. If you're noticing that there's any sort of school avoidance, or there's sort of not doing homework, hiding quizzes, telling you, oh, don't worry about it, mom, dad, don't look at that email from teacher so and so.
Right.
If you're noting any physical issues or visits to the nurse's office, those are often signs that there may be something more going on. And again, reaching out to that guidance counselor or adjustment counselor saying, hey, are you noticing things, or getting a report from the classroom teachers to start that journey into, do we need more to support my son or daughter?
How do you think, because then you talked a lot about kind of like parents having that conversation and teens maybe even reaching out. How would you support, or how do you think therapists who are working with that teen potentially could kind of engage in that conversation and be an additional support in that process?
Sure, absolutely. I think therapists have a really important role in this and supporting parents who, again, often don't know unless they've dealt with their own kind of emotional health or mental health issue. They're not sure how to navigate what may be happening to their child, and they have their own emotions about kind of how they feel and what they may have caused. Parents often feel very guilty about kind of their student and child struggling. So therapists can be really supportive in helping a parent navigate and initiate some of those conversations with the school. They can also help that, if it's a teenager, help that teenager to advocate for what they may need or have those initial conversations with parents who may be kind of just saying, oh, this is because you're a teenager and you're lazy or you just want to play your video games. So they can be really instrumental in helping that teen have that conversation with mom or dad saying, hey, when I sit in English class, I get nauseous. I want to throw up. I feel so anxious that I can't think anymore, and it makes me want to leave. Or when I'm telling you that I don't want to go to school, it's because someone in my math class makes me feel afraid. And so I have a really hard time going, and it's easier to stay home.
Well, and you just mentioned a really kind of like beautiful come together, right, with a therapist who's supporting a teenager and having potentially a really difficult conversation with their parents.
Right. Again, I think, when you think of adolescence, it's this, I think, this wonderful, joyous time, but the amount of growth that's happening and the differentiation, the identity development, this kind of navigating all of these sorts of relationships in your life can really be fraught with large challenges, and figuring out how to have those conversations with parents, with school teachers, with guidance counselors. I think the therapist can really be a great intermediary into not just teaching a teen how do you have these conversations and helping them prepare, but also being the bridge to actually having those conversations.
Yes. And being able to role model, right? Like specific things in that too. Cause I do think it's different when you're helping them prep. You're like, say these things and do this and understand where you're coming from. But when you're in it and you're actually like displaying the characteristics that you've talked about, I think that also gives teens a hope that they're like, okay, cool. Like I can learn these things. I can do that. Right. And then it gives them maybe a higher possibility of like following suit because you're willing to have that conversation. That's like potentially difficult.
Right. And a lot of the things that we're talking about today, they're not, people don't wake up in the morning and say, oh, I want to be so depressed that I can't get out of bed today. Right. And so it's a lot of courage to come forward and be like, I feel so bad that I don't want to go to school. I get so anxious that my brain shuts down and I don't know what 2 plus 2 is anymore. And those are hard kind of moments to be able to show yourself in that way and show that vulnerability.
Mm-hmm. Um, on the same topic, I'm curious of your perspective on this because I feel like there are parents who, and I just want to preface you that every parent is doing the best job they can, right? Like this is not to slam anybody, but I think sometimes you have parents who can understand that and they're really trying to work with their kid to figure out like, okay, like what needs to happen for you to feel safe and comfortable going to school? What needs to happen for you to feel supported, right? And then I think there are parents who are also maybe in the camp of like, suck it up and deal with it. You're fine. The world will continue tomorrow. Or there are parents who are like, my kid is being manipulative.
Yes. So, and I think that's okay. I think parents are doing the best that they can with what they have. Um,
Absolutely.
I think we all manipulate. It's what we do. This is how we navigate the world. We call it, I tell parents, if you notice and you call it manipulation, it's because someone hasn't done it well. They haven't, they haven't become experts in getting what they need from you. Because when I see teens doing that, they are manipulating the situation, but underlying that is they're trying to get their needs met, and this is the only way they know. And so if we can give them a different way to get their needs met, then the adults in the world won't feel taken advantage of or won't feel manipulated.
Thank you so much for like talking on that because I do feel like, I work with a lot of high risk teens, right? I work with a lot of teens who are just like, they're really struggling and they're doing the best they can. And I think that, when we think about human behavior in any spectrum in some ways is helpful. And so I think if we can take the judgment away from it and just be like, what is this behavior, right? Showing us, telling us, how can we stay curious about what's happening to like really dig deep and to understand like what that's about because we're seeing the manipulation, to some extent. I think parents might feel frustrated by that, but getting them to kind of like stop and just be like ask questions about that, right? Like really be curious about that and like dig into a space where like you can understand where that's coming from before there's just like punishments thrown around or like vague threats and things like that.
Right. It's often our behavior is communicating something. And so if you listen to it, and like you said, if you're curious about it, you may get to the foundation of what it's actually trying to communicate. What is your child trying to tell you? And you don't get to that if you're just looking at the behavior and thinking they're just trying to get out of something because they just don't want to do it. They don't like it. It's not as interesting as, watching their favorite show or doing a video game or listening to music or Instagram or whatever it is, TikTok.
TikTok. TikTok, yeah. No, that's so fair. And I think that's one thing for me working with teens that I really love to just like stay curious. And like I love when you're like, I'm a curious person. And I was like, I love that. And I think that that's a huge part of what it's like a characteristic you need to be a really effective like teen therapist, because they're never going to tell you, maybe not, they're not really going to tell you full frontal the first time you meet them what's going on, right? Whether they know or not, you have to build the trust with them. You have to build the respect. You have to build the relationship so that you can really kind of like get to know the framework, right? And that's just a huge part for me. Like I'm in it for the long run, and I think that behavior is like such an important tool in understanding and looking at it from like their eyes with like what they think they're trying to communicate with like certain behaviors.
Right. And helping them learn how to do it better, how to communicate those things. So I've worked with lots of kids and they, will make a suicidal gesture. They'll make a comment and I'll say, is that what you're really telling me? Because it sounds like you want to communicate how bad today is for you or how hopeless you're feeling. Are there different ways to tell me than I'm going to jump out the window? And so, that is our work as therapists to help build kind of the emotional language so that people can communicate better. I do want to get back to a point that you said about parents and pull yourself up by your bootstraps, because I think people go one way or another on this. And I sit in the middle because I think that message is okay if there's some support offered. I think sometimes we move to the extremes where we're like, oh, Johnny can't do anything. He has ADHD and anxiety and depression. And so we're going to let him sit at home and abide by whatever request he makes. That will help. And I don't think that helps. Or we go the other extreme, which is, no, nothing extra for you. Get up, get out, build
Yes.
a life, because that is kind of what the expectation is. And it doesn't matter what you say or how you manipulate or how many suicidal gestures you do. We're still going to expect that. Figure it out. And I think there's a middle ground there where we have to offer support and also the expectation and confidence that I believe you can do it.
Okay, so I'm so glad you brought that up because I agree. Like I think in so many ways we think about parenting in this extreme, right? And I do think that there's a lot of gray area that we can find really good connection in. And the space you're talking about to me feels very much like collaboration, right? So it's not about forcing said kid to do said thing, right? Because you can't really force them when they get to a certain age, right? You can, sure, like intimidate them, you can threaten, there's all these other things you can do. But I think when you are in a space of collaboration with your teen and you're just like, hey, like I want this for you, I feel like you're capable of this, I've seen you be successful in these situations, and also I know that you're struggling, can we identify where those things are so that like I can help you get those needs met so you can continue on and do the things that you want to do, right? And I often talk about like teenhood is like, how do you get through it like as unscathed as possible, right? Like how do you just like make it, because it is really hard and we're asking them to like learn a lot and grow a lot and do a lot and practice a lot and make a lot of mistakes potentially. And I think about that in collaborative, kind of like parenting and supports, and I'm like, this the same goes for the relationship. Like how do you kind of maintain that relationship with your teenager or like with your parent, right, while you're going through these like really sometimes awful things that you're just like, I don't know how to navigate this.
Right. And oftentimes parents aren't, they haven't grown up in the same context as their children. And that's really important to remember. So when we expect parents to know how to navigate the situation, we have to remember that a lot of what we're seeing now and experiencing now weren't part of that experience of a parent. So they haven't lived through their teenage years with access to kind of every little slice of information you could get at their fingertips. They haven't had the experience of feeling the kind of dopamine draw of social media and that connection that you feel. They haven't felt that level of isolation or disconnection from other human interactions. And so it's hard to punish parents for not being able to understand because They didn't grow up in that time. I think, as we keep saying, both of us, the curious piece is what helps that connection, because you can build an understanding of your child through asking them those really important kind of questions about what is it that's happening? Help me understand. Tell me a little more about what this is so that I can better appreciate your day and what's happening in this moment of your life.
Talk to me about this part because I know that the curiosity piece, right, doesn't we had talked about not coming naturally for every parent, right? Or every person, right? Even a therapist, right? They might have this like, a different drive, which is all okay. I'm curious when you are encouraging parents, providers, maybe other people who work with teens to kind of step into that curious space. How do they deal with that initial resistance of that kid being like, F you don't really care. I'm not telling you anything. You have better things to do, right? Like, because I think there are a lot of parents that take that very personally, and I understand why, right? But how would you suggest people respond when like they're trying to build that curiousness and that collaborative relationship, and the initial response is not great?
It feels bad. I mean, it feels bad. And so it's very distressing as a parent or as an educator or as a person trying to hold that sort of stance of being curious. And so you have to tolerate your own distress in that moment to know this is going to feel bad and it's going to be okay. Because with adolescents, what I have found is if you hang in there with them, they will trust that you're hanging in there with them. And that seems so simple. Um, but again, it is really about that human connection. If I can trust that no matter what I do, no matter what it is that I say to you, that you are going to be there for me, then I will come and tell you the things that most scare me, most horrify me, make me feel the worst. I will share that with you when I feel like you can hear it and not reject me.
Well, and I think that was like so beautifully said. And I think that that is like the cusp of so many kids are just like, I don't want to tell you, right, that I'm having these thoughts and feelings or that I'm questioning this or whatever, because I don't know what the response is going to be, right? And like, what is going to be the thing that I say that's going to chase you away forever? And I'm not going to get an opportunity for that.
Right. And it's again, adolescence is such an isolating experience
Mhm.
as each kid is navigating their own selves in the
Yeah,
world. And so to have this fear of being rejected, abandoned, if I say something that's too provocative or that you may not like, or I think will be painful for you to hear, I'm not going to say it if I don't trust that you won't push me away.
exactly. Exactly. So, question for you, because I love this. I think that a big part of anyone who works with teens is kind of like helping parents like regulate in those moments too and not freak out, right? So when you're working with like a teen or like a parent, like how do you kind of help them navigate that and just to stay calm in the moment, right? Because I know that it's really hard when your kid is telling you in the moment, like, all I want to do is fucking die, right? Like, how do you sit with that as a parent and just kind of like work through it and show curiousness and love and compassion?
Yeah, a lot of it, I talk to a lot of people about embracing a pause. 7 seconds of silence and a moment to reset, take in what you've gotten, and then move forward is very helpful. For a lot of people, writing things down, so in conversation, if you can take the role of a note taker, it
Mhm.
helps your brain stay in this rational space and offsets a little of that high emotionality that will happen as you're hearing things. Again, if I'm the court reporter and I'm just tapping in and transcribing, I'm focused on the words and getting that right versus what is actually being said by the person that can really may trigger me, may make me get emotionally volatile in that moment, may be so upsetting. So if I can hear the words, digest what just came to me, pause, and then respond, you're much more likely to have a better interaction between a teen and their parent. It's hard to do and takes a lot of practice.
Yeah. No, I totally agree. I often feel like when I'm talking with some of my teens, I really try to characterize that the initial response from a parent, maybe even like a reactive parent, is more emotional and they've not had a chance to really sit and like think through it. And so I try to really help them work through like that initial reaction, like may not be fully formed opinion, facts, feelings, etc., because they're just giving you that gut instinct. And I think sometimes it is hard for the teens too to sit and like have that reaction happen. But that's where I feel like the collaborative piece comes in of being able to go back and be like, hey, like when I said this thing to you, like this is really what I was looking for. And instead it seemed like you were scared of me or disappointed in me or, whatever strong emotion came up in that moment.
Well, this is I think, a real critical part of what a therapist can do in that bridge of conversation is do some forecasting. You get to play the weatherman. And as the teen is saying something to a parent, you get to, pause and say, hey, I might predict that mom's going to be really upset about this, and she may want to cry. And let's have a moment so we can let mom digest what just happened and then respond. So that helps everyone. It's guiding a parent in it's okay to have that emotional reaction. And you're also a parent to this child and you have to respond in that parental way. But it allows the teen to kind of say, that is the emotional. That's what happens to most people. So it validates kind of the typicalness of that response.
Yes, yes, no, absolutely. And I think your like the main message is really just to like how can we slow down during those periods of time and just like really be kind of like in the moment and also like making sure we're responding from the direction that we would want to like respond from.
Right. Yes, because I think people often regret kind of their what happens in those moments. I think regret can be a real powerful motivator to help us change what we do, but you never want to have again, as a therapist in the room, you never want to have people leaving that space feeling that it was unsafe or that they were unprotected, or feeling like more harm or bad happened than the good of it.
Yeah. Yeah, no, I think that's I guess I'm curious your perspective on this because I think that part of my role in working with teens is to really help them understand and learn what like safe therapy is like, right? How do we have safe conversations? How do we problem solve in a really like nice, appropriate, like good feeling way? And that overall that they have a good experience in therapy as a teenager so that way forever on, right? As long as they live, they'll know how to kind of like assess, understand, seek out and find providers that like can be really helpful for them.
Yeah, therapy. I used to joke with colleagues. I was like, therapy doesn't equal nice. And sometimes I would witness that a lot in schools. Teachers would be nice to a kid because they'd be like, oh, they have depression, they have anxiety, they just got out of the hospital. And nice wasn't necessarily what that kid needed. Therapeutically, they may have needed some accommodation, but it didn't mean kind of just wash it away. And so I think that's a real important piece. For teens to understand and for most people to understand is therapy can often be very challenging, can bring up lots of negative emotions, can feel bad both physically and emotionally, can be exhausting to
Yep.
you. And that's about the growth. So if you walk out knowing, wow, that was really hard, and I learned something about myself, and now I have to do something to change, that's safe.
Yes. No, I'm so glad you brought that up because I do think that a lot of people would probably equate safe with kind, safe with nice, right? Safe with like, I don't have to like shift and change, right? Anything that I'm doing. And to me, I think about it as in like the relationship piece of like, this is a safe relationship. I'm gonna give you like honest feedback. We're gonna have some tough conversations, but I will always be here. Right. And I will like bring my best self into those sessions and like have the conversations that are like necessary, right? Even if it's maybe something that is really challenging and you don't want to talk about. I don't think that necessarily equates to like, let's just be nice together and I'm just never going to give you any feedback. And this is going to be a brilliant thing. And we're just going to talk about the good things because in that way too, you're almost doing them a disservice because you're not talking about the stuff that like really would help them get to the next step in whatever decision they're trying to do or like life change they're trying to make.
Yes, and teens, adolescents are often very perceptive. They're very good about reading people and understanding what's going on. So in my roles, I have seen that kids would come to me, and when I offered them not the kind of kind. It was kind, but when it wasn't just that, when it wasn't just, hey, tell me about lacrosse practice or what are you watching on TikTok or what dance are you learning? What movies did you watch? When I challenged them and offered a space where they were expected to engage, they were like, hey, what is this? And understanding this is how we grow uh, was really respectful to them and having that conversation about, yeah, this is what it's about. You need this at this moment and you may not want it, but this is my job. This is what I'm going to help facilitate with you. And they often came to really respect that and understand that they needed to jump in because it was about their lives.
Well, and I think there's something that's really containing about that. right? Where it's like your conversations, your presentation was very like consistent. They knew that it was going to be constructive. They knew that there was going to be, like we said, hard conversations, but that there was growth that was going to come out of it, right? And I agree with you. I think that they're so perceptive, and I laugh sometimes when I have kids that come into therapy and they're like, "Yeah, all my old therapist did was say, and didn't actually like engage in that process." And it kind of makes me giggle. Like I see, sometimes I'll see postings on like the Facebook pages or like other referrals that are like looking for a really active therapist. And I was like, what does that look like? Right. Like what like, and also like if a person is talking about that, what was their experience like with their last therapist? Right. If they're looking for an active therapist, because I tend to be very like back and forth with people and I really enjoy it. Right. Like some of my teens are like, they call it sparring. They're like, let's go. Like, let's have all these opinions. Let's chat about all this stuff. Like, let's talk through it. And I'm not going to be offended and I'm not going to run away and I'm not going to like, have any like crazy reactions, but I'm curious about their perspective.
Right. And it moves the conversation along. I had a young woman that I worked with for years, and the first, I would say, 4 weeks, she would come in and call me names. And I would be like, okay, there's our 30 minutes, 45 minutes. But at the second week, I said, yeah, okay, I'm a this, I'm a that, I'm a whatever. By the third week, I'm like, okay, now we need to move on because this is your time and you just calling me names. I get it. I am. We can write them on the board. We've done that. Now let's do something new. And pushing them to really move beyond that because that feels safe to them. But you have to understand and feel that it's safe to do other things too, to explore other things, to spar, like you said, and to kind of step out of their own comfort zone.
Yeah. Oh, I love that. I think that one of the things I really enjoy about teens is sometimes working with the folks that are just incredibly resistant. Because to me, when we talked about before about behavior meaning something, the resistance means something. And so like I really love exploring that with them and just being like, what do you think that's about? Right. Like, why are we on week 4 with you cussing me out and telling me all these things, right? Like what is that for you? And I also, I mean, I had a kid who was similar. It took 3 months for this kid to like really like dig in. But I every week would come in after the week before and would bring definitions from Urban Dictionary about different names that he had called me. And I was like, okay. So I went and I looked this up and this is what this says. And so like let's have a conversation about it. And it became something that was almost fun for him, which was the whole key to like unlocking the rest of the stuff that was happening. And we did really great work together. But it took that commitment for me to be like, you know what, this is not about me, right? Like this kid doesn't know me from a person on the street the first time we met. And that there's nothing about me that is like so offensive that it's drawing in all that feedback. This is very much a defense mechanism.
Yes, and well used many times, and they have a lot of opportunities to keep that and use that skill. And again, when we think about manipulation or utilizing these sorts of maladaptive skills, we would call them, they work. So people keep using them.
Yeah.
Adults, when we think about substance use or alcoholism, there are things that work that provide something, and so it's really difficult to try to replace that with something else. In adolescence and childhood, we have this opportunity where those things aren't so entrenched that we can kind of shake them up and move an adolescent to trying a different skill. Hey, you're so good at that. Let's see if you can do this instead. Or you're so good, you're so passionate, I say to kids, you're so passionate about that. You're so good about coming in and calling people names and being really like digging into not moving. Like you would be great at, someday chaining yourself to a tree that you don't want to have them cut down for an environmental cause. Like, let's figure out where you can use this skill in a way that's going to serve you better than now. Because now your parents are angry, the school doesn't like you, you don't have any friends. Like, this isn't working for you. Let's find where it'll work and let's give you something that'll work in this situation.
I love that so much. I feel like that's a big part of my practice is not so much like making all the bad qualities go away, right? But it's like, how do we use them in a way that is productive and effective for that person's life? Because there are like even stubbornness to some extent can be a great tool, right? Like there's all these really great characteristics that we would potentially inherently label as like negative. But if we open up, right, the grand scheme of a lot of workplaces, like if you were an attorney, being stubborn on something might actually be a really great quality, right? So I feel like as a teen therapist, like my job isn't to extinguish those things. It's to help them understand when and how and what's appropriate and in what like intensity, and helping them understand like they have choices. They don't have to use, it's not just stubbornness all the time that they have to use.
Right. Right. Finding that what that skill is and saying, hey, is this the place that you want to use it? And will it get you what you want? At the end of the day, if your goal is to get your parents to agree to something or the teacher to listen to you, you have to put that appropriate skill that's going to get you what you want in the end. And oftentimes when you have that conversation with teens, they're like, yeah, this isn't getting me what I want. So try something else. Let's leave that for it gets you whatever with your friends, but it's not getting you what you want now with your parents.
You mean telling my parents to fuck off isn't going to get me a later curfew?
Yes. I would say, if you went into the bank, if I go into the bank and I say to the person, the teller, like, I want to get an effing loan and you better give me your money, like you're gonna get arrested. So like that may work for your friends. But if you want to get money, if the goal is getting money to the bank, you want to approach that with a different skill set.
Yes. No, I mean, that's actually just a really funny example because you're right. Like if you walked into the bank, you'd get kicked out or you'd get arrested for some sort of harassment. And that's, of course, like not what we want for someone to live like a safe, healthy, happy life.
And it's often what they don't want. I mean, they might say, oh, yeah, I want to get arrested. But ultimately, they come to the point of like, no, I want to get the money. I want my parents to say it's okay for me to go out or stay out late. I want them to say it's okay for me to do whatever. So they can appreciate and understand that what they're doing isn't getting them what they want.
And then it's okay to like learn new things because those new things might unlock other things, right? So instead of telling your parents to like F off and, expect a later curfew, you can actually have a conversation about like why you want that and like what you've been doing lately to kind of indicate that you're ready for that. Or, there's all these really great conversations that could happen instead of like the F off, I hate you.
Right. Yes, they get missed in the moment.
Yeah, for sure. Um, okay. So tell me, I know you do a lot of like supervision as part of just like your practice in total. How did you get to supervising? I'm curious.
Well, when I went for my graduate degree, part of the experience was that you did a practicum, you did your kind of internships, and there was supervision throughout the course of my education, my graduate education. And so it really was important to me that when I was out and done, to be able to offer that to others. Felt like, wow, I got some great learning that happened through supervision, and I wanted to be able to give back in that same sort of way. So all of the places I've worked at, I've kind of brought in some sort of training and supervisory program because I think it's really important. The other reason is, again, throughout my graduate experience, I worked in school systems. I worked in inpatient, but with younger and young adults, so kind of developmental children through young adults. And I found that it was my own understanding of sort of that developmental lifetime that was really helpful in me understanding the adults that I worked with. And so in supervising, I found it was an important part of a trainee's experience to see what happens when you're elementary age, what's happening when you're at middle school age, and specifically with adolescents. So I always said to my supervisees, you have to work in a high school or you have to work with adolescents. They give you a window into what this looks like and develops into as an adult. So when you're working, even if you only want to work with adults, when you're working with an adult, you can go back and think, oh, as an adolescent, developmentally, this is the struggle. This is how it may have manifested itself. This is how it may have presented itself. And here, 30 years later, this is what happens. And so I think that there's a depth of knowledge that happens when you get, even if it's 6 months of experience with adolescent therapy, when you get that, I think you're a better clinician, even if you're just focused on working with adults.
I agree with you wholeheartedly because I just feel like when we're watching young children, elementary age, middle school, high school, young adults, those are all really great exposures, right? For like how little situations that happen in those periods of time can like morph into bigger things in adulthood. And I think that when you sit with an adult and you're going through certain things, then it also gives you a lens to understand what was appropriate and what like potentially should have been happening that wasn't happening, or how something interacted. So I support that 1,000% because I just feel like everyone, and I guess I'm in the boat where I feel like everyone when they get out of grad school should be more of a generalist. Like I feel like you should kind of like step into a role where you're working with a lot of different people and profiles and populations because it's going to help you understand that whole worldview. And I stepped into community mental health right after grad school. I didn't really entirely know what I wanted to do. And like, thank God I did, because I found a population that is so kindred to me that it's like I could never see myself doing anything else. But I think if I had left that and stepped into a really specific niche population, I would have either been like, yeah, I love this, or I hate this, but I don't know what else is out there. And I think for me, I would have felt pretty lost as a therapist.
Yeah, and I totally agree. And it just, we all go through kind of childhood and adolescence. And if you're working with adults, you have that experience, or you also have the added experience of being a parent of a child or adolescent or young adult. And so having an understanding of uh, what the vulnerabilities are, what may have happened, what's appropriate and typical at those different timeframes, I think betters you in working with those adults or working with the adults that are parents to children and adolescents now.
Are there themes you feel like, or characteristics, when you're talking about someone, you're supervising someone who wants to work with, let's say like older children, teenagers? Are there characteristics that you're looking for, you think you try to encourage in them? Or are there themes that you feel like every teen therapist kind of has to like understand if they're getting into working with the population?
I think there are two things. You're not their friend, even though what you do with them may be what friends do together. So I think that's a very important um, differentiation. So when I had supervisees, I would say at any moment when you see an interaction between me and one of my clients and you don't understand what that's for, stop and ask me. Because what may seem like a casual conversation or a game of Uno has the therapeutic underpinnings that is associated with the goal of therapy. And you have to understand it. We're not just playing Uno. If I'm doing that, I'm doing that for a specific reason. And I, as the therapist, should be able to tell you what that reason is. So again, very clear line of we can do things that look like it's friends, but we are not friends. So that is kind of one of those pieces. The other piece is really to kind of stay connected, like the kids and the work that you do. I think so many people find that it's hard. It's hard liking um, kids or adolescents because of the behaviors or the things that they say or what they do. And you have to kind of hang in there with them because they're not doing those things to you.
Yeah, I think I agree on both terms. I think that rolling with resistance and rolling just with like what's happening is a really important skill. And as a teen therapist, being able to like understand and quickly decide, right, like what is happening and what needs to kind of happen in that moment in that session, kind of like make it to what would be helpful. But the other part you talked about with like not being friends, I think it's really interesting because I know that there are a lot of teens that are like, oh yeah, like this is my bestie, right? And it's like their therapist. And I think the confusing part about that, if that is the vibe that happens, is that then they don't understand when you have to file. They don't understand when you have to like have difficult conversations that maybe they don't want you to tell your parents about. Obviously respecting confidentiality and HIPAA, but like, you know, if their safety is a concern, right? Like that's not something we're just going to sit with as a friend. But as a friend, if you were like, oh, hey, don't tell my parents this, they'd be like, okay, cool, I trust you, right? And so I think the differentiation for that isn't just about, oh, I'm a therapist. It's like, no, like being their therapist has implications.
Right. And those are really, what you talked about are situations that come up. You have, especially in adolescence, you have people exploring, experimenting, engaging in behaviors that could be high risk, that could lead to them doing things that put them in harm's way. And so those conversations are important, and those reminders to that person are important upfront and throughout the therapeutic relationship. And the fact that you're not a friend means that this relationship ends and they may not have a choice in that.
Can you say more about that from like your perspective?
Well, so, you have a friend and the friendship may end if there's a falling out or if you decide that I don't, Charity, I don't want to be your friend anymore. I don't like you. But in a therapeutic relationship, there can be an ending that feels unnatural. So if I work in a school, June comes, that's the end of therapy. And I may be your therapist for middle school and not for high school. So yeah, all your friends go with you to high school, but your therapist doesn't, or your guidance counselor doesn't. The other thing that may happen is they may end therapy. They may graduate from therapy. And that may be more on the part of the therapist saying, hey, you're good, you're ready to go. That ends that relationship.
Mhm.
And so, again, they may not have much of a say in those things where they may want to hang on to you. And it's just not appropriate. It doesn't make sense. It's not kind of therapeutically indicated to keep that relationship going.
Yeah. Yeah. Well, and it's interesting because I feel like in a lot of like my first sessions, and this was how I was like trained by my supervisors. I had the best supervisors and I'm like so grateful for them. So like I love that. Um, but one thing that I always talked about in the beginning, and whenever we like revisited goals was to talk about how like therapy might come to an end and like that's okay, right? And that I'm not meant to be here forever with you, but I'm meant to be here for this period of time, helping you on this thing with like these ground skills, right? So that you can continue working on them. And what's interesting is I feel like even with having those conversations, what happens is you have the at least for me, you have this like very few population that are like, okay, cool. Like, I think I'm ready. This feels like a natural end to this. Totally fine. And then I have some folks that instead of having that conversation and they know it's coming, they ghost you. Right. And it's interesting because I feel like that for me is really hard because like I want to have that conversation. I want you to know all the really amazing things that I think you've accomplished like during our time together. And at the same time, I can understand why they may not be ready or desiring or feeling like they can have that conversation with someone that was like they had such a vulnerable connection with.
Yeah, it's a really can be a real important relationship, and to feel like somehow you are letting them go as a therapist, that they just prefer ending it before kind of a clean break. Um, you know, the other time when again, the therapeutic relationship can end, different than a friendship, is when the therapist has come to their limits of their expertise. So there are times it's really important that you may do this great work and then get presented with an eating disorder or something that's out of the scope of where you feel comfortable as a therapist or where your expertise ends. And so it may be shifting, that person to someone else that can better work with them, that can, that has more therapeutic expertise in whatever the challenge they're facing. And that's really hard too.
So I feel like I debate this a lot. And I'm curious since you brought it up, I find it fascinating. When, if ever, is it indicated, let's say, you were working with a kid, teenager, 6 months, a year, or something, you had an established rapport, right? There's a new thing that kind of evolves, let's say eating disorder, and you're like, ooh, I just like, don't have the expertise in it, right? When would it be indicated to get the training and to get the supervision so you can maintain your relationship with that kid? And when would it be indicated for you to be like, you know what? Like, I really think this like whole separate person would just be more effective for you. Do you have thoughts on that?
I do. And I think this is where good supervision comes into play. I think it's really hard when you're as introspective and self-reflective as we all are as therapists. It's really hard when you have a connection with someone that you don't want to let go of.
Sure.
And it's good to bounce that off of a peer supervision group, a colleague that you have a close connection to, but to get some supervision around that. Like, am I hanging on to this kid because I enjoy our sessions together? And here, secret to all of the non-therapists that are watching, yes, we enjoy to different levels the work that we do with the clients and patients that we have. And so it's important to understand, am I working outside of the scope of what is my comfort because I like this kid? Or is there some additional education expertise that I can gain through supervision, through some continuing ed, through a class, or some support in a different way that I can then bring into the therapy. So I don't know that there's an either or. I think it really goes back to knowing yourself, making sure you ask people in your group to say, yeah, this is about making the work good and about the client and not about you wanting to hang on. And then about seeing, you know, how long it will take you to gain that. And is it at the detriment of that person? Because if it's, again, we're saying eating disorders, there's a lot there that if you're working with a kid trying to become expert enough to therapeutically help, that's going to take you more than 2 months, 3 months, 6 months to get to that point. So I think you also have to look at what the new item is, what the new presentation is.
Yes. And I think you hit the nail on the head talking about it as like a skill building experience for the therapist too. And I think there's probably all people that we would like love to hang on to, right? That we just really enjoy working with. That's why we do it, right? And I think at the same time, like I would want people to really analyze, right? Like how long would it take me to reach the level of being effective with that versus like if I referred them to somebody else, I can still get the training if I'm interested, right? But it's no longer driven by, I have to learn this as fast as possible because this person needs it. And then we're not rushing through our own skill building thing. And we're likely going to have a better experience in that.
And again, I think it's hard to know where the line is between um, having someone go and try to build that therapeutic alliance and rapport. That does take time too. And if you have that, it's kind of measuring how much more time do I need to build this sort of expertise to make our therapy effective. So
Well,
again, I think there are some things that are a little harder than others.
totally. And I think that's the thing, like, and maybe the fun part about teens is that there feels like there's a lot of gray, right? And just like taking every situation into account and understanding it and analyzing it from different perspectives and like getting feedback and supervision, and peers consultations just to make sure that you're moving in a direction that's helpful. And it's not just like driven by like you or, potentially by a family.
Right. I think looking at the teen age, because sometimes there are moments that feel like they're more appropriate to transition
Yes.
one to a different kind of therapist. That if you have a 12 or 13-year-old hanging on to them and saying, oh, let me learn this skill and bring it into this relationship, versus you have a 17-year-old that may be going off to college, this may be the opportunity in the conversation to say, hey, you may need something a little more than what we're doing. And let's look together for someone in the community, someone at the college you're going to, that will have that expertise to help you, that they can move on to a next step and it doesn't feel pejorative. It doesn't feel like they're sicker and so you're going to send them out. It feels like, hey, this is what you need and how you get that need met at this moment. And it doesn't mean that in 4 years when you come back home, we can't reestablish a relationship.
I totally agree. I think that natural transitions are a really great time to like stop and kind of like look at things and figure out like where this kid is headed and talk about like the future goals and just like understanding like what they want. And I do think like talking about, transitioning out of therapy and really like the goal process. Because I know in community mental health, every 3 months, right, we had to do a treatment plan update. At the end of the year, we had to do an entirely new treatment plan, right? And I think so, to some extent that created a really great foundation for a lot of folks on like, this is how we talk about progress. This is how we talk about whether or not we're treating like meeting treatment goals. And I think the same thing in group practice and private practice is you have to be having those conversations so that you're not just like being like, okay, see you next week. And you're going to continue doing, kind of like whatever you're doing. Which again, the client might really like it, but it may not be helping them meet their goals.
And I hear from clients, they'll come in and they'll say, oh, I just talked to my last therapist. They were like a friend to me. I'm like, oh, let's understand what therapy is intended to be and that they can be supportive. There's no question about that. However, there are some goals and some direction, and having that transparency with the client to say what is the goal and let's keep on it. Let's hold that thread throughout our relationship so that you understand, so that you end knowing, oh, I'm better at this. I've learned this. I have more introspection about this aspect of my history. I understand my behavior and my communication more.
Yeah. Yeah. No, I just, it's like, so obviously we have so much in common as far as like the adolescent, like teen stuff goes. And it's really great to kind of like have conversations like this because I do think there's a lot of fear around like certain therapists and working with teenagers. And I think a big part of my journey is like, how do we just demystify it? Right? Like, how do we like help therapists build the skills they need to be able to work and just provide really awesome treatment for teenagers? Because they are like literally the next set of humans. Right.
We're building our own support system if we help teens develop and get to the appropriate skill sets to be able to communicate with us as we get older. Yes.
Yeah, you're not wrong on that. That's kind of a funny way to think about it though. I'm like, yep.
They will be supporting us at some point.
Honestly, when I'm like 90, I feel like give me the therapist that's like 25. I would love to like, have that because it's going to be such a different world. I think by the time that happens, and I would love to be like kept up to date and, really into all that stuff.
Right. Yes, lots to learn. I think that we often kind of color adolescents as kind of the unknowing and ignorant, sort of they don't know anything, they don't have the wisdom, and yet there's so much to be learned if we just sit and talk and try to gain some understanding and remain curious. There's so much to learn from them.
It really is. And it's really like it's amazing to hear the perspectives and like where they're coming from with certain things and what things have impacted them. And sometimes I think having those conversations like helps them build a higher capacity for like understanding and empathy for folks who are like not just a teenager. And so I think it really goes both ways. Like they're learning, and at the same time, like I get, because I'm privy to that, like I get to learn too. And I consider myself like a lifelong student in that way. Like there's nothing, like I'm great at teen therapy, and I consider myself to be like an expert in that. But at the same time, like that doesn't mean I know everything.
So they teach you things and they will tell you when you don't know.
Oh my God, can I be honest? Like that's one of my favorite things. Like when I have a teenager who's just like, you don't get this, do you? And sometimes I'm like, no, I don't. Can we talk about it? And they're always like, let me teach you. And I'm like, okay, I would
There,
love
I think people that enjoy working with teenagers, there's part of it that you don't have to guess. There's not, conversations couched in ways to make sure that no one's gets hurt by it or that they don't say it too clearly. Teens just come out and they're like, "Oh, Angela, that shirt is so ugly. Why did you put that on this morning?" Like, thank you. That is very clear.
Okay, so I have had vibrant hair for probably 15 years at this point, right? It is like part of my brand. It's part of me as a therapist. Like I can't see myself ever just being like not having some sort of vibrant hair. And I work with a kid right now who literally tells me every time I get it done, she's like, I hate your hair. And I'm like, I know. Every single time I get my hair done, you tell me you hate my hair. That's totally fine. You don't ever have to dye your hair if you don't want to. And it's become this like very known thing where it's like, after I get my hair done, she's going to tell me that she hates it. And then we're going to talk about how much she hates hair dye. And then we're going to move on. And it's like part of the pattern that's just been really fun. But she's the only one that gives me crap for it. So I'm just like, okay, like, that's fine. You are absolutely entitled to your opinion.
Yes, and it's their opinion. It's very refreshing, again, to hear it. And it's the opportunity, just like the bank thing, to
Yep.
say, hey, this is a safe space and I can take kind of this little banter that you hate my hair. This may not work if you meet a new teacher and say, the same thing. So where can you do that? And what level of trust does that show in our relationship? So
Exactly. She's a spicy one. My favorite. So fun.
again, I think it leads us to being more explicit in our conversations, meaning we have to be very transparent with what we're communicating and understanding why we're communicating something, what the goal of that communication is, and helping those teens do the same. So we have to model it, and we have to help them understand, like, oh, why are you saying that you don't like my hair? What's the goal of it? Are you trying to hurt me? Are you trying to connect with me? Is it a little fun jab that we have? Uh, and that's a learning opportunity for you in that room with them.
Yeah. It's so funny. We've reached the point now where my client will say, at some point when I'm trying to be like, okay, like it's totally fine for you to hate my hair, I can take it. And then we talk about like, scenarios that would be okay and scenarios that would not be okay. That was the beginning. And now my client is like, oh my God, Charity, I know. I'm like, okay, I just want to make sure.
Yes, that's our job, to confirm, to remind over and over, to kind of spiral through the same thing, because it presents itself again over a lifespan. When I see adults in their 50s, 60s, and 70s, some of what they're bringing me is the same that has happened throughout their life. It's just in the different context of where they are, but it's the same sort of pattern. And so let's learn from that. Yes, I'm going to repeat it over and over again because we want to do something different now.
Yeah, totally. And I laugh because I always say that like teens are not like mini adults, right? But I do think that teens without some support in some of those conversations, whether they're in therapy or with parents, I feel like that's still like asking for patterns to be ingrained long term. And so I know that like we're working towards a lot of the adult skill set that we would want them to have, but like their brain development just isn't quite there. So I feel like that's where the grace comes in for me, where I'm just like, let's give them some grace. Like they're still learning, like we're gonna make mistakes, like, it's okay. And in situations like that, it's kind of like with this kid, I'm like, okay, we've gotten to the point where you've learned the things, right? And so now like if you're telling me the things, then you can apply like said things. So it's all a step process. And then hopefully when she's like, in her early adulthood years, she can remember that and be like, oh yeah, my therapist always told me about that.
Or when they get a strong reaction somewhere and they're kind of blindsided by it, they may have this moment of, oh, maybe I stepped into it a little too harshly when I commented to my roommate or my boyfriend or whoever, that I didn't like their hair.
Yeah. Oh, totally. Teens are so fun. Okay, so question, because you had said at the beginning that you wanted to get into more like consulting, right? What is your kind of like future with that?
Yeah, so again, having the perspective of being in the school and being the one working with the students and the districts and the parents and the other therapeutic schools, um, the navigating all of that from the different perspectives was really challenging. It was often, could get very confrontational, conflictual. Everyone often the goal may be the same. We want to have a healthy, educated kid at the end. How
Yeah.
they it can be very different and can be opposing. Um, so trying to be a resource to consult with those different groups, holding all of those perspectives so that there's more collaboration versus conflict. So I'd love to be able to provide that to school districts and to parents and to therapists. Like, how can you be the best and most effective in the role that you have within this moment within the student's life?
Yeah. No, I love that for you. I think you would be great at it because I do feel like it's so hard to navigate the different school districts. And then particularly too, because if you have clients in different school districts, it's like you're learning every school district, right? All the key players. It's a lot to kind of like navigate through. And I can imagine like having someone like you who's able to be like, hey, here's a reminder, we're working towards the best interest of this. And like, how do we kind of like navigate all of this? And like what parts are we? Because some school districts are great, and then some like to play maybe a little bit of hardball, and it makes it really confusing about like where we really headed.
Right. And I think, again, I hold the part of the information where school districts, a lot of um, percentage of the school budget for districts is special education. And so they are thoughtful about managing that money. That's kind of the business aspect. If I'm a parent of a child that is struggling, I don't care. And that's hard. That's where, things come to that kind of opposition. But if you can understand it, like I'm just trying to keep the lights on, and so I have to figure out where I can put the money and be more conscientious about shutting the lights off that don't need to be on. I think parents can then understand that. But parents, it's a really hard and difficult kind of journey to have a child that, again, you don't wake up and say, oh, I'm going to have a kid that's going to have these social emotional needs and really struggle in school and may have these really high risk harmful behaviors that happen.
Right.
And so they often aren't equipped with the support of the resources they need to navigate. And so I have parents that will come to me seeking out their own therapy because they're so stressed. They've gotten, now they're diagnosed with anxiety that may not have happened if their kid had kind of been more quote unquote typical in their school and education. So I often end up doing some parenting coaching around, okay, let's sit down. How do you write a letter? How do you talk to a guidance counselor? And that can be very brief. It's like, I don't need a parent to come in and meet with me for 6 months to manage their anxiety. I can work with them in 6 weeks and help them navigate the IEP process, help them learn some skills and tools to tolerate and regulate their own emotional um, uh, responses to what's going on.
Yeah.
It can be really helpful. Um, so
No, I think that sounds amazing. And I think parents that are in that situation are just looking for all of the supports to kind of like get through it, right? Because at the end of the day, like, I'm just trying to help my kid, you know? And it's a tough place to be in. And I think parenting these days is already more complicated with social media and, the political climate and like whatever else you have. So it's tricky. And I don't think anyone's like the bad guy in this, right? It's just like, how do we come together and collaborate and just like work towards the best interests of like the teams we have in front of us?
and what I'm finding now is I work with a lot of parents, and they're coming at the kind of when they've reached an extreme where it is their own mental health and emotional health that's being impacted. But they wait so long because they're not sure how to get the help that they need along the way, that it's detrimental to them. And so when I talked to you originally, I thought, oh, I wish these parents could have some resources. I wish I could talk to them earlier on, walk them through the process, because I don't know, I don't really believe they'd need therapy and with me if they had some of this stuff up front, if they were given some of the tools to manage and have someone that can walk beside them as they kind of hit each roadblock that a school district may present, or navigate these sort of bureaucratic systems that are well intended but don't really function that great for most of us.
I mean, maybe that's a webinar.
Right.
Maybe there's, when we had talked to, like, I'm very, very big about kind of like elevating, different people in the therapy world, because I'm a firm believer that like we can all exist in here, and it's okay that we have some different perspectives and training and, ways we do things. And I love and believe in business models that also help support kind of these like niche populations, right? Because like even those little things are going to have really, really big impacts long term, even in knowledge getting passed down, even in experiences, right? If we can help a parent regulate themselves and they have 3 kids, right? And they learn on the first try how to navigate the school and how to regulate in difficult conversations, and we've already helped, right? Like all of those kids and the family unit and anyone they might be attached to. So I hope to see that for you. I think that would be like absolutely fantastic.
It's one of my favorite things to do when I talk to parents and they're coming and then they present some sort of parenting struggle, or they talk about their anxiety, and I offer a skill. I say, let's look at, can you do this with your kids? Let's look at making this an activity. If I'm saying, hey, you should, do some yoga moves or meditation or some mindfulness or breathing or something. And again, I try to stay practical. Say, are there 5 minutes in your day with your children that you can do this? And they most often complete and continue to do it. They can sustain something because as a parent, they're motivated to do something that helps their children. They're often not as motivated to take the time for themselves. So when I say to, a mom, like, hey, do this 5-minute exercise, do it with your 2 girls, do it every day. They come back week after week and they're like, oh, the girls loved it. It's so good. I feel like we're calmer in the household. Months later, they're still doing it because it's 5 minutes. And so it can really have, like you said, an impact, not just on that one person, but the kind of trickle effect to all of those places where the environment changes.
Well, then you're building some like really awesome core memories, right? Like with your kids. And like, I think at the end of the day, so many of the teens I work with, like they want to see the effort from their parents, not maybe in the same way when they were 2 and 3 and having these big Easter parties and like, whatever else, but they want that connection with them. And so just by the fact that if a parent is able to spend 5 minutes really connecting with their kid and like investing in that, it means the world, even if they don't say it, right? Even if they're like, I still hate you, right? Like it means so much to them that you put the effort in to like make that happen on a consistent basis.
And that you want to do it with them, that you want them
Yeah.
to be part of that.
Angela, I want this for you.
Yes, this is great. Again, I feel like I'm doing this work, and this is how it's come to me that it's individuals that are coming seeking this sort of support, but it feels like it could be most useful to have people coming in and saying, hey, here's 6 weeks of work we can do as you're navigating this parent challenging moment in your parenting. It doesn't have to be therapy about you and what you're not doing right or what's not functional about you. It can just be, hey, this is hard. This would be hard for anyone. So let me help you with my experience to make this a little easier.
Want to build a scaffolding to provide some like preventative services almost of like, how do we help rein it in so that you can, go about the rest of your life and it's not just going to like totally destroy and deplete you. So I love this. I want this for you. For those of you who are listening, I will drop all of Angela's links below so you have access to her website, social medias, all that stuff. And like and follow. Let me know what your thoughts are down below. I'd love to hear your perspective. And of course, if you have questions or things you'd want to know in the future or guests you'd want to be on, please let me know. I'd love to hear more.